My name is Kathy, and today I'll be discussing how to use homeopathic remedies on ailments, continuing with special concerns of infants, starting with the letters A and B. But before I do this, I wanted to let you know that because I have a great many videos now on many different topics, that I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material in this video. I'll be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and emotions. Then I'll move on to ailments of the brain and nervous system. Then I'll address issues with your skin, nails, and hair. Then conditions of the eyes, ears, nose, teeth, gums, lungs, respiration, heart, blood, circulation, muscles, bones, joints, esophagus, stomach, duodenum, small and large intestine, liver, gallbladder, pancreas, kidney, bladder. Then ailments specific to women and specific to men. Then issues of the hormones and metabolism. Then homeopathic remedies on infections, infestations in the immune system, then issues surrounding fertility, pregnancy, childbirth, postnatal problems, infant ailments, diseases in childhood, special issues of adolescence, and finally special issues of the elderly. Constitutional treatment involves treating the totality of the individual person. Everyone is a unique individual with a unique physiology that responds to substances differently. In homeopathy, it is recognized that people react strongly to certain remedies, and as a result of this, they can be loosely placed into different categories, called constitutional types. Homeopaths talk of, for example, phosphoric types. These are people who react strongly to phosphorus, or arsenicum album types, those who react strongly to arsenicum album. The belief is that people of one type share similarities in terms of body shape, character, and personality, and the sorts of diseases from which they suffer. As an example, Nature people tend to be pear-shaped, have a dark complexion, be fastidious and rigid in personality, and keep themselves to themselves. They also crave salt and suffer from constipation. As another example, Lycopodium types tend to be tall, gangly, of a stooped appearance with an anxious expression and a craving for sweets, and a propensity to produce intestinal gas. Now, of course, constitutional types have their limitations. In reality, each person is an individual, and so there are as many constitutional types as there are human beings. An account must be taken of the sum total of the person's inherent predispositions, past illnesses, diet, general reactions to the environment, intellectual and emotional features, and general attitude towards life. This is what is meant by constitutional treatment. I'll be making detailed videos of the various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas, procedures, and suggestions in this video and all my homeopathic videos are not intended as a substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So, let us continue with learning how homeopathic treatments can help with special concerns of infants, starting with the letter A and B. Special problems in infants. There can be little doubt that breastfeeding gives a baby the best possible start in life. However, milk is not let down immediately after a baby is born. For 3 days or so after birth, the breasts secrete a clear yellowish fluid called colostrum, which gives the baby valuable antibodies and hormones. The baby's sucking causes extra large amounts of a hormone called oxytocin to be released from the pituitary, which stimulates milk production and also helps the walls of the uterus to contract. The balance of minerals, vitamins, and proteins in cow's milk is not ideal for babies. Cow's milk contains many times more sodium, potassium, magnesium, calcium, and phosphorus than the baby needs. 3 times as much protein, which overtaxes acid secretion in the baby's stomach, resulting in digestion and a proliferation of harmful bacteria, and only 1/3 of the vitamin C and 1/10 of the vitamin D that the baby needs. At birth, the baby's head is very large compared to the rest of the body. Head circumference is measured 3 to 4 days after birth and serves as a baseline for growth and for detecting any abnormalities. In tests, babies have shown themselves to be far more sensitive to the human voice than to pure tones and household noises. In other words, they possess an innate ability to distinguish speech sounds from other sounds, an ability fundamental to language acquisition. The first recognized syllables that the baby utters, which are usually produced towards the end of the first year, are preceded by burbling and babbling, as the pitches and rhythms of speech are tried out. Other tests have shown that even very young babies have a good memory for smells, and they recognize their mother by her smell. Physical development is most obvious in babies between 16 and 28 weeks, when the neck and trunk muscles develop, allowing the baby to sit up and look around and take experimental swipes at nearby objects. At 40 weeks, most babies are experienced crawlers, eager for horizons beyond the crib. And shortly afterwards, there are wobbly attempts to stand, though unsupported standing is not usually achieved until they're a year old. The thing to watch out for, particularly in infants, are fever and dehydration. Temperature quickly rises in response to infection, hot weather, too many blankets, and so on, and measures to reduce it should be taken very swiftly. To take a baby's temperature, put the bulk of the thermometer under the armpit for 3 minutes. Persistent diarrhea or vomiting can easily and quickly cause dehydration. Usually, the cause of diarrhea is premature introduction of solids and too much sugar in the baby's feedings. Daily full baths are not essential for a baby. The essential areas to keep clean thoroughly are eyes, face, hands, and bottom. Granules are the most convenient way of giving homeopathic remedies to babies. They quickly dissolve on the tongue and cannot be spat out as easily as pilus. Alternatively, crush a pilule between 2 clean spoons, if you have no other form of the homeopathic remedy, and then dissolve it in a little warm water, and drop it on the baby's tongue with a dropper. Asphyxia of the newborn. The failure of the newborn baby to breathe, which is more common in small for-date babies, overdue babies, and babies whose mothers have received pethidine in labor. The baby doesn't move or cry and turns blue. After 5 minutes of not breathing, brain damage is likely, and after 10 minutes, the baby will die. If the baby is being delivered at home, call 911 and start mouth-to-mouth resuscitation, removing any fluid or mucus from the baby's mouth first. Once the baby is breathing, give one of the emergency homeopathic remedies that follow. If mouth-to-mouth resuscitation does not work, artificial respiration may be necessary, which is a tube inserted through the baby's mouth and into the lungs and attached to a respirator. In the meantime, give Carbo 30C every 2 minutes until the baby loses the blue tinge and is breathing and drying normally. Specific remedies to be given every 2 minutes until the baby loses the blue tinge and is breathing and crying normally. Baby collapsed, limp, cold, nearly dead. Use Carbo 30C. Baby cold, blue, gasping for breath, failing pulse. Use Laurocerasus 6C. Birthmarks. Birthmarks are caused by local pigmentation of the skin or by an accumulation of tiny blood vessels close to the surface of the skin. Pigmented spots, also known as café au lait. Spots, because they are coffee-colored, are usually permanent. They are much larger than ordinary moles, irregular in shape, and may have hairs growing out of them, and there are 3 types of these navi marks, caused by collections of tiny blood vessels. Capillary navius, which are flat pink or pink-brown spots. These usually fade within 18 months. Strawberry naivus, which are strawberry red, raised at about 1 inch across, and grow rapidly at first, then slow down and grow with the child. Most fade after 3 years. and port wine stains, which are mulberry colored, slightly raised, and often extensive patches on the face or limbs. These generally persist into adult life. Disfiguring or unsightly birthmarks can be treated by cosmetic surgery or disguised with skin-colored creams. If a strawberry navius bleeds, apply pressure and give phosphorus 6C every 5 minutes until the bleeding stops. Then give 3 drops of phosphorus 30C at 12-hour intervals. For a strawberry navius that does not bleed, give 3 drops of Thuja 30C at 12-hour intervals and apply Thuja mother tincture every day for 3 weeks. If these measures do not help, see your doctor. Bronchiolitis is a viral infection that causes swelling of the membranes lining the small airways, the bronchioles, in the lungs. It usually occurs in children under 18 months old, often after colds, and is most dangerous in children under 6 months old. If, within 2 to 3 days of starting a cold, the child begins to wheeze, has difficulty breathing, looks blue around the lips, and refuses food, see a doctor within 2 hours, as there may be a danger of heart failure or pneumonia. Specific remedies to be taken every 10 minutes for up to 10 doses until help arrives. Child hoarse, wheezy, blue in face, exhaled breath feels cold, attack comes on in evening, use Carbo 30C. Child exhausted with trying to breathe, too weak to cough up loose phlegm, nostrils sucked in with effort of breathing, vomiting, use Antimonium Tart 30C. I have a great many videos now on many different topics, and so I've decided to make several different video playlists so that it's easy to find the videos of greatest interest. So please check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.